Everybody, we are coming to you live at the Core Outlaw in Cantata. If you are watching this, hopefully you are looking for the lecture we have this afternoon on understanding heart rate training zones. We're really excited to have one of our exercise physiologists from our cardiac rehab department here today. Ryan has a great presentation plan for you that's really going to break down the fundamentals of what heart rate training zones are and how, regardless of where you are at in your training plans process, you can incorporate this really fascinating data into getting the results you hope to see. So for those of you that are here today, a few quick things so you can maximize your experience online. We have questions and comments available on both Facebook and YouTube. Make sure you type those in. We've got somebody here that'll make sure we get those questions answered before the end of the talk today. The second key thing, if you're running into any audio issues or you can't hear us, send us a note, and if there's anything that we can do to troubleshoot that, we will. Other than that, do know that this lecture will be on the TMC YouTube channel after we have completed our live and in-person event today. You can't see them, but there is a great audience that's socially distanced and masked up behind me that will be here as well, asking their questions in real time, so we'll make sure that you hear the answers to those questions as well. We appreciate you taking the time to join us today. Let us know what you think of the talk, and I'm going to hand things over to Ryan.
Awesome. Welcome, everybody. My name is Ryan Dallago, and I'm an exercise physiologist with Tucson Medical Center. Specifically, I work in the El Dorado Cardiac Rehab Department. And some of you may be wondering, what is an exercise physiologist? It's a very fancy term. It's someone that essentially creates exercise for anyone that's had heart surgery. So if you're someone that's had open heart surgery, a stent placement, a valve replacement, any of those kind of things, I help to get you back to where you were before surgery, if not better. Today, I'm going to be changing roles just a little bit, and I want to see how I can help you understand your heart rate, specifically in training. Okay, our goal for today is to look like this woman. No, I'm just kidding. A few months off exercise because of COVID. Let's safely get you back to where you were before. Like I said earlier, if not better. In addition to that, I'm also going to help you identify how each training zone can benefit you in different areas of the body. What does that mean, Ryan? Well, let's talk about fuel. Should we use fats? Should we use carbohydrates? I'm going to help you determine each heart rate and its effect on those different types of things. In addition to that, we'll talk about the muscles that are recruited as well as the systems that are activated. If someone's looking to go to the gym and just burn some fats, I'm going to show you how to do that. If someone wants to go to the gym and burn carbohydrates to decrease their blood glucose, I'm going to show you how to do that today. Okay, oops. Okay, going back one. Why is heart rate training so important? I've got 3 areas for you guys today. The most important, to the far right, preventing overtraining. By knowing what our heart rate is doing, we know how to make sure to set up the next workout. Should I go easy? Should I go hard? How does my heart rate look that day? What is my maximum heart rate and what is my resting heart rate? That's something that we're going to work on today. Also, heart rate training is important because it trains the aerobic system. We're talking about our cardiovascular and our pulmonary systems without overtraining our skeletal or muscular systems. Sounds a little complicated, nutshell version. How do we make sure that we get a good workout, but we're not too sore the next day? Lastly, we're going to identify specific training zones, just about 5, that help determine cardiovascular goals of your workout. Okay, last slide before we dig into our bread and butter. Improving your workout with heart rate training. Whether you're someone that's looking to get into a local 5K race or someone that's looking to improve their stamina endurance, we can do that with heart rate training, with structured training, with knowing exactly what we're there for. What is our purpose in the gym today? What are we there for, and what is our ultimate goal? Improving cardiovascular systems, decreasing our systolic and diastolic blood pressure, making sure that the heart is working more efficiently, as well as decreasing cholesterol. We want to promote HDLs, which are high-density cholesterols. Those are good for our heart. And we want to get rid of our LDLs, which are low-density cholesterol molecules. We want to make sure there's a good balance, but also we want to promote the good stuff. Also, if you're someone that's looking for weight loss today, I'm going to show you how heart rate training will specifically just burn fat. In addition to that, on the previous slide, we had talked about preventing burnout. I want to give you guys the best chance to make sure that week after week after week, you guys are able to work out and not have to say, you know what, I have to take the day off. It's too much for me today. I want to give you guys a better chance at success. Last thing that I put on the slide is direct metrics to improve your fitness. The nice thing about the devices that I'll show you to track your heart rate today, they analyze everything. So they'll tell you how you're sleeping, how you're eating, what your resting heart rate is. All of these different metrics develop a baseline so that you can figure out, am I ready to peak? Am I ready for my race? Or are my numbers improving? Are the things that I'm doing appropriate for my goals? Okay, first question that I want to answer today is, how do you measure your heart rate? Couple different devices that I put up on this slide. In 2021, guys, all of these devices are pretty much going to be the same. Any of these devices are highly intelligent, starting with your Apple Watch, Garmin watches, Fitbit watches, Whoop straps. I put membership fee because I want to let you guys know the Apple and the Garmin, just about $200. The Fitbit, I checked on Amazon today, I think it was about 70, it's down to 40. Perfect option for tracking your heart rate. It's a good way of at least starting, getting into the game, for lack of a better word. Pulse oximeter. Anyone that's been to the hospital, anyone that's had that little device put on their finger that they're wondering, what does this do? That's going to track your heart rate. It's also going to track your O2 saturations, which is really important. In 2021, any of these devices up there will track your oxygen saturations as well. They're just going to be a little bit more accurate. You're going to see more accuracy. With any of these wristwatches, you guys are looking at about 90% accuracy with your heart rate. Once you go down to the pulse oximeter, we go to about 80%. But here's the thing. As soon as you sweat during your workout, 80% drops to 40. So they're very, very inaccurate when it comes to tracking it on machines. Third, and I included this, but I really am not recommending it today, gym cardio machine monitors. Anybody that's been on a treadmill, a recumbent bike, an elliptical, you've put your hands on those metallic plates to determine your heart rate. They're calibrated at the initial start and then never again. So I'd recommend try to get one of those watches if you can. If that's not an option for you, if that entry-level Fitbit of about $40 to $50 is too much, go with the pulse oximeter. Throw it on your finger, see what your heart rate looks like. If you're looking for more, if you say, Ryan, I am ready to start training for the Olympics, 2023, get me ready. What we can do is you can add a heart rate strap to your workouts. You're going to see an increased accuracy to about 99%. It's widely used for any age, any particular goal set. The really nice thing that I want to show you guys, any new gym, they're going to have nice equipment that'll actually connect to your Bluetooth strap. That means you don't even need a watch. So if you're someone that likes to see the numbers in real time, this is a great option for you. Costs just about $70 to $80. Okay, so we've talked a little bit about heart rate. Now we're going to determine what range is most appropriate for me. Before I dig into this, guys, I want to let you know, any exercise, please talk to your doctor before. Please consult your physician. Let them know what you may or may not be doing, what the goal of your exercise is, because they know. They know your medications. They know your overall performance. They know more information to give you better feedback of whether or not you should be doing these activities. 5 different levels for you guys today. I'm going to show you 2 different ways. This is method number 1. 1, 2, 3, 4, 5. If you tell me that you're a 1, Ryan, we're on the couch eating potato chips. Way too easy. If you tell me it's a 5, it's so hard that you can barely breathe. So let's outline each one of those stages. Stage 1 and 2, you're going to start to see weight loss. This is going to be your very light to light stages. 2, 3, and 4, you're going to actually start to improve metabolic and muscular fitness. 4 and 5, these are sub-maximal paces. This is where you start to see improvements in VO2 max. That's the ability of your lungs to expand to their max capacity. In addition to that, you see your lactate threshold increase. Lactate, what is that? Lactate is something that makes your muscles sore. It makes you sore the next day. If you can prevent that lactate from entering your body, you'll get a better workout. Option number 2. I wanted to simplify everything. You know, if it's too much, if you say, Ryan, you know what? 5 different zones, too much for me. This is your baby. I simplified it for you. We're talking about, instead of 5 zones, this is going to be your heart rate training zones. At 60 years old, that's an average max heart rate of about 160. That equates to a zone of 80 to 136. The time duration of working out in that area, I'll explain a few slides later. 65, average max heart rate of about 155. We're looking at about 78 to 132. At 70 years age or more, max heart rate of 150, we're looking at about 75 to 128. If you're younger than 60, and if you're looking for that information a little bit more simplified, I also put a graph towards the left for you as well. Okay, 2 things that we need before we get started. We need our resting heart rate. We need our maximum heart rate. And we're going to start with the resting. What is your resting heart rate? There's a lot of factors that go into this. An initial heart rate starting today. Don't worry about the past. We're looking at about 60 to 100 beats per minute. And it's going to be about less than 50 for anyone that's an athlete or that's used to a high amount of exercise. When to check your heart rate? The best time to take it is at rest in the morning. First time you wake up, before you have that coffee or bean juice, take time to get your resting heart rate. Also, make sure you have about 7 or 8 hours sleep before you take that resting heart rate to make sure there's no fluctuations. The nice thing about resting heart rate, it can be an indicator of potential cardiac issues. Sometimes the resting heart rate is the first thing to let us know something's going on in our bodies, whether good or bad. Use your resting heart rate to help with that. Dehydration. When we don't have electrolytes, our heart can't contract the way it should. Make sure that your resting heart rate is where it should be. If it's higher or lower, you might notice that dehydration is occurring in the body. Increasing or decreasing of resting heart rate. That is an indication that your fitness levels might be changing. It's a good thing. You're working out 3 days a week, you're feeling better, your resting heart rate might go from 70 to 60. That's an indication that your heart is working more efficiently. The last thing that I have in this slide for you guys is I did want to include some medications. Beta blockers and statins will prevent your resting heart rate from moving. So just know, just kind of take that into account when you take that resting heart rate. Okay, what is my maximum heart rate? Your maximum heart rate is the max capacity of your heart. All of the zones that I showed you before, 1 through 5, they will be calculated from a percentage of your maximum heart rate. In addition to that, I went over this before, but I want to again, the maximum heart rate can be very strenuous on the body, specifically the heart and the lungs. Please talk to your doctor before you try figuring out your maximum heart rate. Okay, you're probably wondering, all right, Ryan, we figured out our resting heart rate. How do we figure out our maximum heart rate? And I have 3 ways for you guys today. The first way, the easiest way, set up by a cardiologist. You typically go in, they put you on a treadmill test from anywhere from 10 to 20 minutes, and they make sure that your heart is working the way it should. A nice result that you get from that test is your maximum heart rate. If you go, you know what, Ryan, that just doesn't sound fun. I've got 2 other ways for you. I've got a personal heart rate max test. 2 different ways, one outside, one inside. We'll go over the first one. A 3 by 3 minute test outside. You put on your wristwatch, Hopefully it's early in the morning, hasn't gotten too hot yet. You run for 3 minutes. And then you walk for 3 minutes, followed by one more interval of 3 minutes of running. That last 3 minutes of running will show you your maximum heart rate. Simplified, it's the last heart rate, the highest heart rate that you have during that exercise. The 1 to 2% grade treadmill test, that's where you go to a gym, you step on a treadmill, you run for 5 minutes, you set that incline to 1 to 2%, you run for another 5 minutes, that will tell you your maximum heart rate. If everything I've shown you so far is just a little too complicated, and if you're looking for the simplified version, the easiest way to do this today, 20 years ago we took 220 minus our age. But science shows it's just not very accurate nowadays. So what we do is we do 208 minus 0.7, and that will be multiplied by your age. For me, I'm 28 years old. That equates to a heart rate, a max heart rate of about 189, which is pretty true for me. My max heart rate's about 190, so that equation, pretty darn close. Okay, what are some common mistakes when you're incorporating these zones into your everyday life? The first one, all the way at the end, we're focusing on training your max heart rate. It does nothing. Trying to increase your max heart rate from 190 to 195, the science shows it doesn't do anything cardiovascularly. It doesn't improve blood flow. It just increases the max capacity of the heart. We're looking for benefits. We're looking to prevent risk factors. So instead of focusing on the max heart rate, we're gonna work on the zones. 10 minutes in zone 1, 10 minutes in zone 2, and I'll kind of show you different ways of getting there. Rechecking your max heart rate. Things that are gonna change your max heart rate. As you get older, our heart rates start to decrease. Other things like fitness, a higher level of fitness will equate to a lower heart rate. So make sure you're constantly rechecking it. If in June you recheck your heart and it's a max heart rate of 150, I would recommend 6 months later, do the same thing. Check that heart rate, see if it's changed. If you do your max heart rate test here in Tucson, and then you go up to Flagstaff at 7,000 feet, you're gonna see a huge difference. Just kind of know that elevation and climate, especially living in Arizona, all those kind of things are gonna affect your ability to recheck your max heart rate. Last but not least, applying zones to different types of exercise. I am training for an Ironman event in November, which is a huge thing, right? So I have to take it bite by bite, piece by piece. When I say that, I use target zone rating, target zones for cycling versus treadmill. It's gonna be different. So my zones for cycling are gonna be a little bit higher than my zones for running. So zone 1 for cycling for me, it's a little bit harder than zone 1 for running. Just know you might have to change your zones for different types of exercise. Again, all 5 zones here for you guys, and we're gonna break down each one of those zones next. Zone 1 is gonna be very, very light. This is your very low intensity zone. Examples of exercise for this zone would be walking or cycling. This is where you start to see the benefits for recovery. It encourages range of motion and ability. In addition to that, it also allows you to have full conversations while you're exercising. Nancy, how are the kids? How was your weekend? How are the dogs doing? You should be able to conversate in stage 1. Stage 2. Stage 2 is where you start to see fat loss. Now we're specifically relying on the burning of fat. For those that are diabetic, this is a great range for you. If you're looking to decrease your blood sugar, this is what you're looking for. It's low intensity on the body, but it provides a high muscular fitness. This essentially, if you were to create a metaphor, you have a car engine. You're giving that engine oil and gas, you're keeping it hot, but you're preventing that Mustang from overheating. So you're keeping the body in check, you're getting benefit, but you're making sure that it doesn't overheat. Examples of zone 1 to 2. Don't get in these ladies' way because they're mall walkers, and I'm sure many of you have seen this before. Go easy. Yoga, light to moderate stretching, brisk walking, light water aerobics, hiking on flat trails, all great examples of zone 1 to 2. Stage 3 is going to be moderate. I did want to include a photo of the loop because that is a great resource for Tucsonans. You've got 120 miles of paved, no cars, none of that kind of stuff loop. Use it, guys. Whether you have a recumbent bike, they've got e-bikes coming out, whether you like to run, walk, or rollerblade, great activity for stage 3. For stage 3, we're starting to focus on our speed and our form. This is where we start to see improvements on mile times. We start to see improvements on cardiovascular and pulmonary health. The biggest thing when I say cardiovascular is you see an improvement in your ejection fraction. Some of you that have had cardiovascular issues, you may know what an ejection fraction is. For those that don't, it's essentially the amount of blood that leaves your heart at one time. To see an improvement in that, we like to work out in stage 3. That's the best way to increase that ejection fraction. The unfortunate thing, the downside of stage 3, this is where you start to see the buildup of lactic acid. Like we talked about earlier, lactic acid equates to soreness, to muscle soreness. So as that starts to appear in the body, what you want to do is you want to work out 10 to 20 minutes in zone 3, but allow yourself to have about 5 minutes of rest in between. Let your blood essentially catch up with all of the lactic acid that's been put into the body. So if you're working on it on a treadmill 10 to 20 minutes, step off, slow down the settings, rest for 5 minutes, let your blood start to work through all those different molecules of lactic acid, and that'll improve your recovery. Science shows that doing that, most patients, 10 to 20% less soreness their next workout. Similar to other stages, with stage 3, conversation is going to be reduced. If you want a way of evaluating if you're in stage 3, you really shouldn't be able to have full conversations. We're looking at just little things throughout the day to talk to your workout partner, but not full conversations. It's a little too hard on the body. This is taken at Sweetwater Trails over on the west side of Tucson. This is going to be a great example for zone 3. This is recommended for healthy older adults. Cycling on the loop, like I said earlier, road cycling, great examples of zone 3. If that's not going to be an option for you, I did want to include recumbent stationary bikes as an alternative. Lap swimming is a great zone 3 exercise, as well as hiking at elevation. Stage 4, and as you can see, those guys are in Flagstaff, so they are huffing and a-puffing. What we have for stage 4 is this is going to be our hard stage. Now you should see yourself start to breathe hard. You're improving your pacing and your speed. We're no longer using fat as a fuel source. Now we're relying on our carbs. In addition to that, we boost our lactate threshold, the ability for our body to take on that lactate without having to tell our body to stop. And really, I wanted to include this similar to zone 3. The best time to be in zone 4 is 3 to 10 minute intervals with 1 to 2 minute recoveries. Stage 5, this is going to be your stress test. This is your sub-maximal pace, maximal effort. This is a large buildup of lactic acid, long recovery times. So guys, keep it low, 1 to 3 minutes. Keep it nice and easy. It's not recommended for anyone that's had pulmonary or cardiovascular risk factors. This will push the maximum heart rate. So really, if you have any of that stuff going on, use the equation that I showed you. Don't use stage 5. Examples of stage 4 and 5 are going to include sprinting outside, cardio machines such as a rower, elliptical machine, circuit training, CrossFit, all those kind of things are going to be zone 4 and zone 5. We live in Tucson. We don't see this very often, but if you're a cross-country skier up in Flagstaff or places like that, that's going to be an example of zone 4 to 5. I did want to include this for my athletes. If anyone's watching today that's an athlete that's looking for high intensity interval training, talk to me after or send me an email. I'd be happy to help. HIIT training is specific for athletes, for people that are on a treadmill for 10 minutes. And then they take that speed and incline up for a minute and then back down, up for a minute, and then back down. That's been shown to have much more variability on the heart. It's a little bit better for athletes, but if anyone needs information on that, please let me know. I included this because I wanted to show you guys just a general rule of thumb. As you get older, you can see the heart rates start to decrease. At 30 years old, your max heart rate in theory is about 190. At 70 years old, in theory, that heart rate's going to be about 150. So just kind of use that as you start to plan your exercise. Okay, so one more tool in addition to the heart rate zones that I want to show you is called a rating of perceived exertion scale. Again, I'll say it one more time. If you tell me you're on a 1, you're on the couch eating potato chips, Ryan, don't talk to me. I need a blanket and a pillow. If you're a 10, it's so hard that I can barely breathe. Possibly I need to go to the hospital. So we kind of want to avoid that max effort. Guys, use your RPE scale as an evaluation of how you're doing. When I get on the treadmill on a Monday and I have the same exact settings, my heart rate is 120. And then what if I do that on Tuesday? What if I get on that treadmill on Tuesday and that same workout with that same heart rate is now a higher rate of perceived exertion? So when I came on Monday, I said, you know what? That heart rate of 120 on the treadmill, 4 or 5, easy peasy. But the next day I come in and my heart rate is the same. My settings on the treadmill are the same, but now I'm saying now this feels like a 9. I did this no problem yesterday, but today it feels a little bit harder. Just know that rating of perceived exertion scales, the 1 to 10 scale that I have outlined here, that's great for saying, you know what? Even though the heart rate training is good, even though the heart rate is where it should be, I just don't feel like myself. Maybe I should back off of my workout today. So use that to kind of gauge almost like a body scan. Scan your body. How do I feel? Mentally and physically. Use that as a gauge for your exercise. Okay, so I've outlined what target heart rate is. I've outlined maximum heart rate as well as resting heart rate. Now you're probably wondering, well, Ryan, how long do I work out? So let's talk about that. Let's start from the base and work our way up. Let's build a base. For those that are just starting exercise or it's been a while since you've exercised, let's start with 10 to 15 minutes. Focus on frequency over duration. I'm going to say it one more time. Frequency over duration. Guys, the science shows 3 walks a day for 10 minutes, much better than 1 walk for 30. What that means is every time you work out, heart rate goes up, blood pressure goes up, but everything intrinsically comes back down. That's important. We want to see that ability to go up and down. Gradually build yourself up. Don't just run out to Tuamamoc Hill and hope for the best. Start with maybe 20% of it, just one piece at a time. Watch your heart rate, see how it does the more you put at it. Adding variation. As humans, we are creatures of habit. So when you go to a gym, it has to be that rusty old treadmill on the far left part of the corner. We always gravitate to the machines that we like. And that's okay. That's what keeps you consistent. That's what keeps you coming back to the gym week after week. So why I put that? Try out different machines, but if you love that rusty old treadmill, go for it. The American Heart Association recommends that adults get at least 2 to 2.5 hours of moderate to vigorous activity per week. Ideal workout, 30 minutes a day, 5 days a week. How many people do that? Probably 0. I don't do that, and I'm training for an endurance event. So what I'm recommending, why I'm saying that is use the heart rate to set you up for the best possible chance of success. If you're tracking your heart rates, you know how you're doing throughout the week. It prevents you from having to go, okay, Monday went well, Tuesday went well, but I just did too much and now I have to take Wednesday off. Use your heart rate to allow you to consistently stay in the gym or any type of exercise. Doesn't have to be the gym. Focus on feel, not always on the numbers. If you're a numbers guy, that's totally fine. I am myself. I track every heart rate, even when I'm in the shower. No, I'm just kidding. But I track a lot. But truly, the best way to do this is focus on the feel of it. See how it feels. If it feels wrong, don't do it. If it feels good, keep with it. Okay, so I've shown you the 5 different zones. Now, for the everyday human, I incorporated it into a 60-minute workout. As you can see, we've got zone 1, 2, 3, 4, and 5. I wanted to include a warm-up because a warm-up is so important for your body. It lets your body know that it's time to activate our sympathetic nervous system. It's time to activate these systems and get benefit. If you just jump on a treadmill, your heart has to realize what you're doing. Zone 1 and 2, of that 60 minutes, that's about 40 to 50% of your workout time. We're looking at about 30 minutes or so. Zone 3, 10 to 15% of your workout time. We're looking at 9 to 10 minutes. Zone 4, 5 to 10% of your workout time. Very short, so about 5 to 6 minutes. And then lastly, zone 5, about 5% of your workout time. And again, that's about 60 minutes total. That'll equate to just about 3 minutes. If I could have put that cool down in red and then bolded it and then italicized it, I would have. Because the recovery, the cool down, is so important. I can't stress that enough. Whatever activity you're doing, make sure that you have time to cool down. A lot of people get pale. They have shortness of breath when they get off machines. They have different things happen to them because they don't give themselves time to recover. At least 5 minutes, but if you can do more, that's perfect. Okay, so that was using the 5 zones, but if you like the simplified version, I've got a workout for you as well. So let's just go over some of the metrics before we get into the explanation. At 60 years old, like I had said earlier, that's going to be a max heart rate of 160. So you want to be in that range of 80 to 136. So let's talk about that. We're talking about a 5 to 10 minute warm-up. Gradually increase your heart rate to that 80 to 136 range. I put here about 60%. So during that 5 to 10 minute warm-up, you want to increase your heart rate to 60%. If you're in that 60 years category, 60% of that is going to be about 96. So slowly get your heart rate up to about 96. Once it's there, keep it in that range for about 30 minutes. Keep it in that range 20 to 30 minutes. That's the best benefit. If you have any difficulty, if you're starting from a very baseline fitness, that's okay. What I'd recommend is start with 10 minutes, 5 minutes off, and then slowly work your way up to that 30 minutes. In cardiac rehab, what I do for a living, our science shows for cardiovascular patients, 20 to 30 minutes in that target heart rate range. That's what we focus on because that's what the science shows gets you better. What if my heart rate is too high or too low? A high heart rate or a low heart rate is the first indication of training, but also that something might be happening with your heart. It could be tachycardia, it could be AFib, it could be dehydration. At least it's something to tell you, hey, you know, maybe I need to call my doctor. Maybe I need to figure out what's going on here. It's a nice way of having a metric to track your health and your fitness. Like I said earlier, medications are going to affect the way your heart rate works. Both statins and beta blockers. Pacemakers are going to keep them either low or high. Just know that'll affect your heart rate. Sabine, who did a presentation a few weeks ago, she talked about heat, so I wanted to tie those two together. The Arizona heat, my heart rate's about 70. The second I go outside, it turns into 85. Just know that's going to be a big impact on your heart rate. How to personalize your zones. Once you've got your target heart rate, I suggest that you apply it to all the different types of activities that you do. Whether that's cycling, walking, running, whatever it is, just know that different zones are going to be equated to different sports. Cycling and running are not the same. You might have different zones. So just go back. Once you have the presentation, go back to that slide that I had showed you. Just recalculate them for different sports. Your max heart rate during running might be different than your max heart rate for cycling. For our purposes today, for the population that I'm speaking to, I really want you to focus on steady state workouts. When we do HIIT training, when our heart rates are going up and down, the heart typically won't show what it actually is on the watch for about 5 minutes. So you don't know. So for our benefit today, I recommend steady state workouts, like the one I just showed you, the 60-minute workout or the 30-minute workout. Those are zones that you stay in and essentially stay in for a long amount of time and then don't have to go back to the short effort training. The last slide that I have here is 80-20 endurance training. That's for the endurance athletes that are watching today. We're looking at about 80% zone 2, which I'll talk about next. 80-20, so 80% zone 2, and then that 20 is going to be any other zone. So really focusing on zone 2. Breaking up your cardiac workout. Cardio machines. Variation is the key to life, as most people know. Variation is also the key to seeing results. So just a very simple that you try a week is 15 minutes on the treadmill, 15 minutes on the bike, 15 minutes on the elliptical, and then about 5 minutes of weights. I wanted to let people know that the studies and the science are changing. Studies show that you and your body do not start to burn calories until after the first 20 minutes of exercise. So a lot of science is showing that if you work out, if you do weights before your cardio machines, you burn more calories. By doing weights, you start to activate the calories so that by the time you get to the treadmill, you've already started that burning process. Again, cool down, 5 minutes. It can be a big shock to the body, so we want to make sure that we're giving ourselves time to bring everything back down to 0. Lastly, stretching. I come from a physical therapy background, so I'm a huge proponent of stretching. I don't think you can stretch too much, but 2 things that are benefited from stretching: lowering your heart rate, breaking up lactic acid. If there's anything that I can provide to you guys today that you take away from this, kind of our Willy Wonka golden ticket, for lack of a better word, it's the value of zone 2 training. I've thrown a lot of information, but this is really the most pertinent. Zone 2 training is against everything we've ever learned. Zone 2 training is saying you don't have to work the hardest every time you go to the gym. You can actually work at an easier pace, but over long durations of time, you get more benefits with less injuries. That's really important. We want to try to stay away from those injuries. Zone 2 is steady training just above the easy zone. The largest benefits include building aerobic base as well as endurance. This is not recommended for anyone looking for immediate results. It's going to take the most benefit. It's less of a physiological toll on the body, leading to less inflammatory responses. It facilitates a parasympathetic response, meaning that once you're on that treadmill, all your body wants to do is go harder. This zone keeps the floor low, keeps the ceiling low. Make sure that you can do what you want to do, but don't overburn your system. Okay, we're going to get nerdy a little bit. I want to show you exactly what benefits you're receiving. In zone 2 training, it's all about the mitochondria. The mitochondria, is the powerhouse of the cell. Takes in oxygen, takes in nutrients, creates fuel. Everybody thinks that we have the same mitochondria when we're born, but that's not true. The more we exercise, the more we work out in specific areas of the body, the more we can recruit mitochondria, which increases our metabolic flexibility, the ability to take in nutrients, take in oxygen, and create energy. The nice thing in zone 2 training, we can teach those mitochondria to eat fat before glucose. We can tell them exactly what type of fuel we want them to have. The excess lactate reduction, hydrogen ions in our body, they lead to exhaustion, they lead to longer recovery times. Staying in this zone 2 training will prevent that. At the beginning of the presentation, I outlined increasing VO2 max, the max capacity of your lungs, as well as stroke volume, the ability for your heart to pump blood, all going to be increased with zone 2 training. Mitochondrial health is the critical key to longevity. Okay, how long should I be in zone 2? Professional coaches are recommending 2 90-minute sessions. Professional coaches are suggesting 90-minute sessions twice a week. Modifications, if that's just a little bit too much, too quick, we're looking at 75 to 80 minutes, and then take breaks. Do 10 to 15 minutes, lower those settings, go for a few, maybe 4 or 5 minutes, then return to the settings that you were at before. Ryan, what about my recovery heart rate? Is it important? There's a lot of different things that I outlined about your recovery heart rate, but really the only thing I want to show you today is this graph over there. That's a graph of a healthy person versus an unfit person during a stress test. On the y-axis, we've got heart rate. On the x-axis, we've got time after exercise. As you can see, once the stress test ends, the heart rate is at its max capacity of about 175, 180. The difference being is both heart rates come down to their resting heart rate. The blue line is much more of a curve. This shows that a healthy person, a fit person, their heart rate is going to come down much quicker than an unfit person. With an unfit person, you're seeing more of a linear decrease. And really, with the heart rate training that I'm showing you guys today, you're going to get more towards that blue line. You're going to see a decrease in your recovery time. If it typically takes you 45 seconds for your heart rate to go from 150 to 120, over time with what I'm showing you today, you'll see that decrease. It might be 20 seconds, it might be 30 seconds. Using your heart rate to help you recover. 20 years ago, there was no emphasis on recovery. They thought it was 80-20. They thought I'll work out 80% of the time and I'll recover 20 when I'm sleeping. But it just doesn't show in today's society that works. As a general rule, a lower recovery heart rate after vigorous exercise is better. That shows that the heart rate is prepped for the next workout and that it's feeling well. Dehydration will decrease your ability to recover. Dehydration, not having electrolytes in the body, prevents the heart from contracting the way it should. So just make sure that you're getting, for men, it's about 3.7 ounces. For women, liters, for women, we're looking at about 2.7. Okay, so make sure you're keeping up on the water. Make sure you're keeping up on the electrolytes. A lot of people think they have to go to Fry's and buy a 12-pack of Gatorade. Not true. Most of your electrolytes are going to come from your diet. The biggest things that we're looking here for are potassium, sodium, and calcium. Great ways of getting that: vegetables, dairy, a lot of potassium and calcium. All those kind of things are great for decreasing dehydration. As you can tell, I'm talking a little fast today. That's because I've had a lot of caffeine. Make sure that you keep your caffeine low. If you're having 4 cups a day and that's just you, that's okay, but just know it's going to decrease or increase your resting heart rate. It is going to change things. Our hearts are like any muscle. Our heart's at a heart rate of, say, 120 on elliptical, doesn't know that it's different from a treadmill. So our hearts don't know what we're doing. They just care about our heart rate. So do activities that you enjoy as long as you can get those heart rates into those zones that I've outlined today. Last slide for today. Prioritize your recovery. Regular exercise over time. Don't throw too much at the body too quick. Avoid too much. And really what you can do is periodize your training. 3 to 4% increase in whatever you're doing per week. That allows the body to recover, and it makes sure that you don't have to take weeks off because you're too sore or things happen. Proper nutrition. Really my purpose here today is to give information for heart rates and the benefit of heart rates. I'm not going to talk too much about nutrition, but just know an adequate ratio of fats, carbs, and protein, very, very important. Sleep. Optimizing the quality of your sleep. Apple Watch, Garmin, Fitbit, Whoop, all of these devices will track your REM cycle, your non-REM cycle, how long it took you to get to bed, How long did you stay asleep for? Did you wake up 25 times even though you slept 8 hours? Those are going to track your recovery. But the nice thing about these watches, they will tell you how hard to work out the next day. Should you take it easy or should you push yourself? Avoid alcohol before bed. That's all I'm going to say about that one, but the alcohol will truly affect your heart rate in a negative way. Heart rate variability. And I'll briefly go over this one. If anyone needs more information on this topic, please let me know because this is kind of my baby. HRV, and let's break this down. During a 6-second strip, your heart is beating. So you may have about 6 beats. In a healthy individual, there should be equidistant amount of space between those beats. With heart rate variability, we're looking to see a slight variability between those beats. What does that show us? It shows us that the heart is not having to tell itself when to beat. It's a little bit more free. It knows when to beat. It doesn't need an impulse to tell it, okay, it's time to beat. What does that mean for us today? Heart rate variability is a great way to determine whether or not it's appropriate to work harder or easier the next day. All watches that I've outlined today will show you all those metrics. Last but not least, when we are stressed, we release cortisol. Cortisol prevents us from losing weight. So I recommend either meditation or breath work to help relieve stress. Last slide for today. This is a painting of your workout on Monday. Use everything that I've given you today to improve your workout. Stay consistent. Do things that you enjoy. If you have any questions, my email will be available. Email me. If you go into a gym and you're like, Ryan, what does this machine do? What muscles does it benefit? Send me an email. Let me know. I'm a huge resource, so if I can help in any way, please let me know. And yeah.
Any questions from the audience?
Thank you.